Welcome. This is our health channel. I'm Dr. Justin Lin. We're shooting here in my clinic at Rehab and Revive Physical Therapy in Tustin, California. Our health channel is created for us by one of us. Not too long ago was I where you're at, wondering all these different health questions, how to sift through about wellness, fitness, and injuries. All the information out there, how do you really understand what the true source is, and does it even make sense? So sit back, relax, and learn. Because after all, this is our health. Welcome to today's episode on our health channel. I'm Dr. Justin Lin of Rehab and Revive Physical Therapy. Today I've got this great program for you. We're going to discuss migraines and headaches. I've had it. I know many of you have had it. So I spent a lot of time and a lot of training trying to get to the root of this. And today we're going to discuss that, how we can treat it, how you can manage it, and everything else in between. So stay tuned, and we're going to go through some illustrations, and we're going to go through some models, and we're going to go through partly some of my theories that are going to go together and going to make some sense today. Thank you. So let's get to the root of it. Let's talk about these headaches, migraines. So far, many people, sometimes it eliminates their chance to go to work. It really impedes on their daily function. So why wouldn't we want to get to know this? Why do you want to have to take medicine or pills to really try to manage this? There's so many different reasons that can cause headaches. It could be the pills that you're taking themselves. They could be, some of the exercises. Dehydration can cause headaches. So you want to make sure you're going to your primary care physician or your physical therapist to really get some of these things addressed. What I can do over here and what I'd like to do at my clinic is to really work on some of these nerve things and these nervous system. So we all like to know how all this affects the brain and why we get the sensation. It's not our brain aching, it's really the sensations that are being fired throughout our system that create this headache. So, we're going to take a look at the autonomic nervous system. This is our fight or flight. And it's very important because, when you're getting excited, you want that adrenaline get pumping. And then when you want to relax, you want all those systems to go down. So a very important hormone that is created or is stimulated in our body through our adrenal glands is something called cortisol. And so cortisol over a long period of time, keeps you heightened, it keeps you excited, it keeps you ready to go. If you've got you're stressed out all the time at work, or you're stressed out for any daily life, you're anxious about this hormone is actually pumping through your body quite a bit. And that affects all these things here in your head. And so over a long period of time, however, if it's a chronic thing, you're chronically stressed, you're not happy at work, you have a relationship that is not working out, and it's just giving you so much turmoil, you've got this cortisol going into your system, and it really breaks down the very cellular matrix at your head and your brain and all the cells in your body. So this is a very fascinating thing, this cortisol thing. You want to get it managed. You want to get it, you want to get these things taken care of. We'll talk about that in another segment, but let's talk about what's going on physiologically that might make a little bit more sense to you and to me and to everybody else. So let's focus a little bit right here. And this is actually a great picture of some of the things that are going on in our head. You've got the ocular nerves that are attached to the brain. This actually goes here. And then you've got these things that go to your jaw, your salivary glands. Sometimes when you've got headaches, you're not hungry. It affects this autonomic nervous system. It's got this heightened response. So we always want to keep going back to why chemically is this going on and how do we manage that? How do we get the adrenal glands to not pump? Part of it is, yeah, sure, you want to meditate. Maybe it's to calm that nervous system down. But maybe at a mechanical level, something's pulling on these nerves. And this is what I like to investigate here at Rehab and Revive Physical Therapy. But we really want to see if these things are tensioning or pulling. And we all know that if your nerves, if you take a giant nervous system and you take a picture of all these nerves down through here, wouldn't you just suspect that if something is snagged or caught, maybe perhaps by some scar tissue, that they're really going to limit the mobility or the extensibility and the movement of these nerves to have that flexibility. We all want that flexibility. And sometimes people with carpal tunnel syndrome, sciatica, they often get headaches together. So we really want to get down to treating all these things at your legs, at your arms. We really want to take care and eliminate any restrictions to those nerves so we can create a more healthy environment. That way it's not stressed out, not only mentally stressed out, but really physically stressed out. Is there something mechanically creating these restrictions, this flow, this ebb? We all know nerves send signals to our body and nerves sensitive to, they send signals to our muscles, to our bodies. So we want to make sure these things are healthy. We want to make sure we got this ample flexibility and ample mobility, ample, in a way, conductivity to all these necessary structures like your eyes. So sometimes when you have migraines, you get aura and it feels like the signal's off. You have a little bit of brain fog. Maybe something's compressed in the brain. So you can see how at this level, this autonomic nervous system, your cranial nerves, they're affecting these things. And what I like to do here is really work on that flexibility, really get that mobility going. And maybe that's sometimes some of the greatest solutions. Sure, like I said before, and I mentioned before, you've got some chemical things. If you're taking pills that are maybe not going well with you, if you've got some kind of food you ate that was a little toxic to your body, or you're dehydrated, and so maybe some of the supplements and extra vitamins can also, if you've got too much vitamins running through your system and minerals, they can really alter your sense of being. And so I like to go to this next picture, and you can kind of see once again it's a little bit more closer up of the spinal nerves here. So we want to look at this, and all these affect some major important structures in our brain. So this headache, like I said, we're trying to think of it less of something going on in the brain, but maybe something going on in the perception that the brain feels. So this is really essentially maybe what's going on. Something pinched here, something pinched here, something pinched there, something in the eye. And we're going to get down to, when I treat, what we're going to do to really eliminate some of these symptoms of this headache. This pressure, this chronic pressure is also another thing that I hear from patients. So, we all know, not we all know, but we all want to understand that, when these nerves are going out, there's also a feedback sensory component, not just a motor component. So that's a giant loop. You got two ways to look at it. And so we really want to affect these things. And you can see, like I said, if I'm pulling on something down at your leg, wouldn't you think something's going to be tied up there? I use the analogy of going to Disneyland or any amusement park, and anyone holding all those balloons out there on a giant string, on many strings. You got hundreds of balloons, and if I took those balloons and I started to twist and yank, wouldn't you think one side drops because of the pressure and another side elevates and gets too loose? That's the way I like to think of it. It's just this pulley mechanism. And so if you got to get all these things pulling around, in your legs, even in your organs, like the last little placard, then you can see that maybe there's something to this nerve tension, this nerve restriction. And then we're going to go down to this one, and this actually a little bit more complicated picture here of the nervous system, but once again it's repeating what I'm just saying about all these nerves. Now think about that. This is all the external nerves, all of them shooting all upside, and sometimes you feel it always in the same spot. Maybe that's something to think about. Why do I always feel on the right side? Why do I always feel on the left side? Why does maybe I get some jaw pain before my headache starts? Sometimes there's all these big indicators creating this inflammation before you actually have your headache. So you want to really dull down, and you want to think of all these other external and internal things that are going on, whether it's the cortisol, whether there's these restrictions. And then the next segment of this episode, we're going to talk about how we're going to do, what I will do to treat these symptoms and help manage them for our patient population, and for you all out there really trying to understand and grasp this. That way it's not a lifelong thing. You don't want this to be battling over and over and over again. You got to take migraine medicine and really just makes you feel sick in the stomach. And maybe these are the things that perpetuate and continue ongoing. It'll drive you crazy. It'll make you make you take days off of work because you've got all these headaches. So let's really try to fight that, fight it and try to manage it. So the next segment, we're going to talk about what I would do in the clinic aside from managing your legs, your nerve tension, but really getting down to the head itself. So stay tuned. So how are we going to manage this? What would happen if you or I were to go to the clinic and really check this out? If you're looking for pills, sure, you'll get enough pills and from all the MDs, everyone out there. But if you're looking for ways to properly manage it, I do suggest going to a specialist that understands headaches, that understands how to manipulate some of these bones in your head for those pressures to decrease the sense of that adrenal gland working. We don't want those things really running too excited in our body. You don't want those things to get out of control. Something we call brain flame in some cases. So you don't want this inflammation to be running around rampant. You want to organize, we want to manage, and we want to decrease these pressures. So at your head, what we have here, and some people don't really understand or realize that the bones in our head can still move a little bit. I'm going to get a lot of criticism for this, but after puberty, a lot of medical or Western medical thought is that these things fuse. Now, if you really thought of it in this way and you're not thinking commonsensically, what happens if we have so much pressure in our head? What happens to those bones? If they're locked in and you get all that fluid or that cerebral spinal fluid, that pressure growing, then what happens to that? That means the pressure builds up inside. If our bones are locked, and we really got to think of that, and we got to really change our mindset, because I like to think of this. If you've gone to the East Coast or anywhere where it snows and gets really hot, when I used to live in Washington, D.C., we had on the bridges these locks that were, that were connected the bridges. And so when the temperature got hot and the concrete expanded, it got closer, it got further apart. It created room. So these locks opened up. And so when it got colder, it got closer. And that's, what I'd like you to think, this is what happens. So when that way it just creates the connectivity of the bridge. Now, I like to think of it that way. This is what happens to our sutures in our brain, whether they open up because, one day I'm having a lot of pressure, a lot of stress. We need these things to open. There's a mobility, there's a mechanical explanation for this. And you really have to be conscientious of this. And on days you're relaxing, you want this thing to close, sure. And that's what we want. It's expanding and closing. So what happens, I really want you to think, what happens if they're not doing either, they're not opening or closing? Then we have some issues. And so on those days, you've got that stress. And this happens anywhere. It can happen in your jaw. It can happen, inside. You can see so many of these ridges here that we want to manage. So what would I do? And this is what I would do if anyone with these headaches came in. I'd first manage those nerves. We talked about that before, whether it's, doing stuff for your arms, doing stuff and removing restrictions for your legs, going into your organs and actually manipulating those. But what I would do pretty soon is get to the head and really try to start what we call this is craniosacral therapy. And this was invented by, a couple people. There's Pierre Barrel, and there was also Upledger, the Upledger Institute, that really discusses some of these things. Very fascinating therapist to go to. I've had a number of these sessions in my life, and I was hooked, and it made sense. So what happens is, I would start, moving these restrictions of the muscles around the face, really starting to get there, make sure these are aligned. Sometimes when I get right here and I'm manipulating some of these bones, they're uneven. Some of them jet this way, some of them are rotated, some of them are, you want them in a nice line. These are right behind your ear, and you know what? I bet if you've got headaches, and especially they target one side, you know, you want to feel right back here if there's like some asymmetry. You can also check your cheekbones, and sometimes they're asymmetrical too. And sometimes, you know, the biggest indicator for me is the eyeballs. You know, sometimes one eyeball sunken in more than the other. You can just touch that, you know, the depth of it. And sometimes the eyes open one more than the other. So sometimes when you get these auras, maybe you watch your eyes. Maybe it's a little bit shut. Maybe it's a little bit more tiny. And you want to really be conscientious of this, because, you know, if it's really tiny, that means something's pressuring it. It's not allowing your eyes to open. So I actually like to manipulate and move your eyeballs. Now, it's a weird feeling, of course, but really getting these things and putting them in play, you know, really can manage a lot of this tension that goes on, that tension type headache before these migraines start, before these migraine attacks. So this is what needs to happen in order to manage your migraine, not just with pills, or, you know, as long as all these other things are ruled out, maybe it's a mechanical thing. I want you guys to think there. All right? So thank you very much for listening to this episode. This is my health. This is your health. This is our health.